process. So there are 7, I think I'm going to bring them all up. We'll do one at a time. So I've got 7 different types of studies. So I'm going to talk through them in brief terms for each of them. And then what we're going to do is get a list of different types of studies and see if we can categorize them. So I think I mentioned it before, I'm quite an active learner. So what I do is I'll give you some knowledge and then I'll ask you to do a bit of a task just to make sure you're understanding what I'm saying. And obviously it helps you to kind of verify for yourself that you're understanding what I'm saying. So the first type of study we're going to look at is effectiveness. So an atypical effectiveness question is, does a particular type of intervention work? So does exercise reduce depression for patients with depression? So you're thinking about, does a thing what I do in my practice on a day-to-day basis make a difference to a certain population of a certain outcome? Another type of, just bring this, I hate when sometimes it works and doesn't with ticks. 1 second, I'll get my mouse, wherever that's gone. Yeah, put it back up. Okay, the next one is prevalence. So prevalence is an epidemiology type study. You're typically asking the question is, how common is a specific issue within a population, or how often does a particular incidence or event occur within a population? So an easy example for this may be like COVID-19. So at the moment, we're getting a lot of data through the press in regards to the incidence rates of daily incidents of COVID-19. So that's how many times does somebody in a day get diagnosed with COVID. What we don't often get is the prevalence, which is how many people currently have COVID, because obviously we don't really see that kind of long-term tracking of that population. But there, the type of questions you'll ask is, how common is an issue within a population? The next question is qualitative. So a qualitative question is, how does somebody feel? How does somebody experience? These are things which can't be numerically valued easily. So these are more kind of exploratory. So we usually use these techniques when we're not sure of the phenomena which we're investigating and we want to know kind of what's going on. So we know something may be happening. So for example, people may not be turning up to a particular appointment. What we want to do is know why that may be, and we have no particular clue. We have some ideas, but we're not sure. So what we're going to do is carry out some questionnaires and surveys to kind of inquire with the population of why this phenomena is occurring. So it's more of an exploratory type of approach to research. The next type is diagnostic test accuracy. So these are the types of studies which look at, does the test actually test what it should be testing? So this is one of the study types we'll be discussing. They're the kind of 4 which I'll actually be covering in today's session in more detail, which will be the effectiveness, the prevalence, and the qualitative diagnostic accuracy. So diagnostic accuracy is saying that if I gave a patient a test, is it actually producing the results, and does that results represent a real clinical phenomena such as COVID-19, for example, or depression, or whatever the actual test is trying to test. The other type of test is prognostic, which is looking at if a patient has a particular disease, what's going to happen long term. So for example, if I have back pain, what is the long-term prognosis for employment, for example, or disability? So what will happen to me long term? If I, for example, have cancer, what would be the long-term prognosis for a particular type of cancer? So what they do is they follow a patient over a period of time to see what would happen based on that particular disease process or a population of that disease. You've got etiology, which is looking at does a particular behavior relate to a particular disease? So if I smoke, does it cause cancer? So that in this case, what we do is we pick a population. This could be people who smoke. We then follow them over a period of time to see if then they develop a particular pathology or a particular disease, to see if there's an association. And then finally, cost effectiveness. There are more than 7, but by using these types of simple research questions, it allows you to kind of find the relevant research easier, and also helps you to frame the question in the right way. And sometimes when I'm working with clinicians to look to develop their practice, I usually try to think of these 7 different ways of where we can find data to help their practice. So they may say, at the moment, I feel that I'm not using my staff efficiently, and I feel that I don't have enough skill in my particular staff to address my population, which I'm trying to look after. So what I might say is, well, because we are not sure about what the common problems are in your population, what we may want to do is look at prevalence type of study, because what we're trying to identify is your clinical questions really about how common is a particular issue, and obviously what other issues are related to that particular population, so we can then start looking at skill sets and looking at staff who may support in that particular population. So I'll give you a clinical scenario. We've recently done a prevalence review about comorbidities. So the comorbidity is about rheumatoid arthritis. So the clinical question was, what other common comorbidities are presented with rheumatoid arthritis? And this information would help clinicians, if they were running a rheumatoid arthritis service, to see what other skill sets or other clinicians they may need in their teams to support patients with rheumatoid arthritis, knowing that they're often a complex case scenario. So in this review, we identified there's a large mental health prevalence in rheumatoid arthritis. So there are things like large levels of depression and anxiety and PTSD in that particular population. So from a staffing perspective, that would help you inform that you may need somebody with a mental health background to provide that service, because we know that's a common comorbidity presenting with that population. But you see, if you classify these questions into these domains, it makes it a lot easier to start looking at the research. So we're going to look at the frameworks, but you'll see how it categorizes your questions and make sure you start pulling out the right variables to answer your particular clinical question. So just so to see if you kind of got most of that in regards to kind of coding the study types, what I've done is created a list of different studies. So these are, how many is there? 1, 2, 3, 4, 5, 6 different clinical questions. What we need to do is try to code these based on what type of study type would it be. So if you want to write A and then put the number, so if you see I've obviously numerically valued the study types, and then obviously I've coded the categories of questions into A, B, C. So it makes it easier that you can just put A would be a particular type of study. So if you want to have a look through and see if you can code these, so what type of study type is the first question, and then so on and so forth. If you feel comfortable with your answers, you can put them into the chat bar. So you'll see that obviously we talked about it last week, that there's the facility in the meetings to chat. So if you want to put your answers in, I mean, you can put them all in at once and put A is whatever number it is, and B is whatever number it is, and then press enter when you've done, or you can do it one at a time. So I was going to give you a couple of minutes to do that, and then we'll go through the answers. This is kind of the atypical first steps of carrying out kind of your research, is to start thinking about what is my question and what type of studies would answer that particular type of research question, because then it allows you to use these frameworks to develop your question further. So if you have a look through and see if you can code these particular questions. Is anyone going to be brave enough to put their answers in there in the chat bar? It'll reassure me that people are still out there. I think it's one of those where you can see the chat bar, but you don't see people there. Oh, there we are. Somebody's typing. That's great. So yep, perfect. So somebody's A is right. You're right there with A. So if you don't feel comfortable to put it in the chat bar, just write it down so you've got it in front of you, and then you can go through your answers. And the next slide, he's got all the answers on. But I'll give you a couple of more minutes and then we'll go through the answers. So as discussing before, I think this is kind of like your first stage of developing your research question. So if I was approaching any type of critical appraisal topic, this would be the process I would take at the start. I'd write my question down in rough and then start thinking that what type of data source would I need to answer this question, what type of study, and then from there it's going to allow me to select a framework to then develop my question further. Brilliant. People answering, that's good. Okay, so what I'm going to do is I'll bring the answers up and then we can obviously compare and just make sure. I think some of them are right from what I can see on the chat bar, so that's really good. So I'm going to bring the question, the mapping up. click. I'm going to actually use the click bar. Where's your mouse? There's my mouse. There we go. Click. There we go. Not too many clicks. Brilliant. So the first question is about populational. So it's about prevalence. So it's how common is the daily cases of COVID-19. This is be prevalence / incidence. In this case, it's incidence because it's the number per day. And we'll talk about how you decide if it's prevalence of incidence. I'll give you some examples later on. The next question is the cost effectiveness of exercise or exercise diaries. So that's easy because it's got a costing. Usually, like I say, you've got with them type of studies a bit more complex because you've got two types of outcomes. You've got the financial assessment, so how much it actually cost in various modelling methods, and then you've got the effectiveness. If it's cost effective, you want to know a particular outcome. What does it make a difference in? So they're usually a quite complex type of study. The next type is question C is exercise, and I think that was right. So in the answers in the chat bar. That the exercise is A, so it's effective. Sorry, C. C is number 1, which is effective. So does exercise reduce depressive symptoms? I think I've obviously talked about it just a minute ago, but for your first type of critical appraisal topic, this is the type of study type I'd recommend you to do. I'm not saying that the other 7 types aren't appropriate. You can use them if you feel confident. The difference will be is that when we for the other sessions, when we talk about, for example, the critical appraisal topics, and when we talk, critical appraisal tools, and when I talk about the outputs, so Valerio is going to be talking about the different outcomes which are assessed in these type of studies, we will be mainly focusing around effectiveness. So it's just because the course is relatively short, we've tried to obviously address multiple study types. So in this study today, or in this session today, we'll address 4 different study types, but I won't be able to address all 7 in that much detail. But I have in the resources for each of these slides. So when you obviously download this slide, you'll see that in the notes section, there's a reference for every type of category, and there's also lots of references for different extra reading if you want to do a more advanced type of study. But effectiveness would be the atypical study type I would recommend initially to do a critical appraisal topic, because this will help you develop the basic skills first, and then when you've got confidence in doing your search and you've got your more confidence in interpreting your results, you can then look at more more complex studies such as diagnostic accuracy or prognosis. So we'll go through the rest. So D is smoking, obviously cause cancer. So this is etiology. So what they want to know is, does the behavior relate to the disease? What is the prognosis in regards to Bell's palsy and swallowing? So this is prognostic. So there's a sense of, does a patient with this condition develop this particular problem? It's similar, but obviously post-disease. And F in regards to kind of barriers and facilitators. So this is qualitative. I've already put one on there. The actual review we were doing is actually both barriers and facilitators, but this is an example. But yeah, so anything where you're asking in a sense of a qualitative type of non-numerical value. Brilliant. So what we're going to do is look at the very first type of study, and as I mentioned, these are the easiest one to kind of use for this course. So if you're looking for I'm not saying an easy ride, because obviously it will be in the sense that you're harder because you might not find all the studies for what you want, but it's probably the easiest case scenario for where you would most likely find the most relevant studies and most likely interpret the results in the right way. Would be a kind of an effectiveness type of question. I've seen a couple of questions already which are based around this type of stuff. So these are kind of, I think the ones about falls prevention and seating or equipment. So that would be a similar scenario to this. Does a particular intervention result in a particular outcome? So the acronym what they use is called PICO. It's based around 4 categories, so 4 criteria, which you would have to decide to see your study type. So what is the population you want to examine? What is the intervention? What is the comparator? So what are they going to compare it to? And what is the outcome? So I'm going to give you a clinical scenario, which is one which we did recently for a commentary what I wrote. So it was the population was Parkinson's disease. The clinician wanted to know from a kind of a discharge perspective if they should be referring for home exercise. So they wanted to know if home exercise was effective. So you'll see actually underneath, I just realised I've put the title for the commentary we wrote on this. So they want to know if home exercise was effective compared to alternative. So the 2 alternatives, which was the comparators, were placebo and in the centre-based exercise. So they want to know if I'll put my mouse so you can see, if Parkinson's disease patients, if they had home exercise, would it be better than having nothing at all? And would this particularly improve balance-related activities? So when you think about your clinical questions, you want to break it up in those 3 categories. So I want you to kind of a go at this now. So it'll just give you a quick go at it so you can understand the principles. And we'll go through this with all the different study types. I want you to try to think about what is the most common type of patient you see. So what is the ones you see every day, and these are the main populations which you provide a service for. What is the intervention? So what is the most common intervention or the last intervention you used? I wouldn't worry about a comparator. So if you specify a comparator early on, you can sometimes restrict yourself too early. So I'd probably leave this open. And then what is an important outcome for your population, or what type of outcome do you measure on a day-to-day basis? So if you want to have a go at writing your own effectiveness type of question using those particular questions there. And who's brave enough to put it in the chat bar? Let's see if we can see if we want to type it in the chat bar. And it can, let's say, who do you most commonly see? What is the last intervention used, and what outcome? You can put it as you can either write it as an acronym, so you can put P and then the population, I, then the intervention, and then O for the particular outcome, or you can write it as a clinical question. So does whatever intervention is effective for whatever patient population in reducing or increasing whatever outcome? So you can propose it as a formulated question or split up. I typically use these tables, so you'll see for your homework you'll be filling out one of these tables, but if you want to have a go at typing it in the chat bar and put I know I've got my staff here, so I see Joe's here and Catherine's here. They're from our research team, so if they want to put their own. Okay, we're doing I don't think I'm doing one at the moment with the team effectiveness. The ones we're doing at the moment are prevalence and oh, we have got one. I've got one with Joe. We're doing the effectiveness of collaborative learning in stroke rehabilitation. So there is an effective one. Brilliant. Someone's posted one. Brilliant. That sounds great. I'll give you one more minute and then we'll move on to the next output. So I'll just talk about the. There it goes. They're fantastic questions. Brilliant. Yeah, so that's a really good question about singing and dementia. Fantastic. Brilliant. I'm going to give people a thumbs up for when they're good questions. There they are.
James, can we just make sure everybody can see the chat bar? Because I know I can't see it on my half. I don't know if it's because I'm logged in with Lancashire, South Cumbria.
Yeah, it probably is. I think we got the worksheet. So the chat bar should be up here. So if you're in this big screen here, there should be a little chat bar there, which allows you to type it in. So if you click on that symbol there, it should produce it.
I think that might be the case with some people. If they're logged in with their own institution, they might not be able to see. That's
fine. As I say, as long as they're writing it down, the key is just verifying the outputs. It just gives you the ability to kind of see others and obviously check your own. I think we sent out a worksheet in the last email for the session just about logging procedure, just to switch accounts to 365 before logging into the meeting. But like I say, the key is that you obviously writing the answers down and then just verifying that you've interpreted the concepts correctly. So we're going to move on to the study type. So we've kind of got some good ideas there, and we seem to be developing questions in that domain. So that's good. So I'm going to give you kind of just a brief types of studies. So these are studies which are the atypical study you'll find, and it's just so you can contextualize the values. So if you've obviously written down a population, an intervention, comparator, and outcome, I want to show you how these kind of translate to study types. I talked about it with my teaching staff last week about this idea of functional knowledge. So I didn't want to complicate the things too much. So what I'm saying here is right, but there is a lot more complexity to different RCTs which I don't want to go into depth with because it may confuse you. I just want to try to keep it very basic initially. So the things what I'm talking about will cover about 90% of all studies you'll see. There will be 10%, 20% of studies which use a slightly different technique, which are a bit more complicated, and I don't want to mislead you too much at the start. So the idea is that I kind of work to the knowledge where you'll get 90% of studies you'll be able to interpret, and there will be that kind of 10%, 20% which use a slightly different method, so which are outside what I'm going to describe now, but they will work in the same domains. They'll just have a slightly different approach. So the main 3 study types you'll see is going to be, I'm going to put them up in a minute, but the random control trial, a non-randomized trial, and then a repeated measures or singles arm study. So we're going to talk about random control trials first. So as a kind of procedure, you've got a particular population, and we'll use the Parkinson's disease as what we've just talked about previously. So we've got our population we want to observe, which is our Parkinson's disease. So we recruit some Parkinson's disease patients. We then allocate them to 2 interventions. So we've got an intervention here, which will be the home-based exercise, and then we've got the control group, which we're comparing it to. And it's really important for you to identify what that is in RCTs, because certain control groups are not placebo, so they can be actual active controls. So for example, for the actual study we did here was actually comparing home-based exercise against center-based exercise. So even though it showed no difference, we were trying to identify that because we wanted to say that one was not better than the other. So it's just important when you're looking at the control group that you make sure that you understand what type of control it is, because if something's maybe not effective based on the findings, it could be that case that the control group is something which would make them better as well. So they're just trying to establish if the intervention is the same. In this case, I've given you the easiest case scenario, which is a placebo. So this is a patient group who's not receiving any type of intervention, which we think would be affecting the outcome. And in this case, it's balance. What we do is we randomize the population. So what we're going to do is we have our population at the start of the study. We're going to put half in one group, half in the control group. What we're going to do is do this by random sequencing, which is usually done by a computer. So what you do is you get a big list of patients. The computer then just generates numbers next to them, which is either 1 or 2, and then they're allocated. And then what we do is we measure the outcome at the end of the study. Typically, it's measured right at the start. So what you do is you have an outcome here, which you'll be measuring how good they are between the 2 groups at the baseline. And what you're hoping to do is that the outcome you're observing, because you've randomized them, they should be equal. If they're not equal, obviously you'll need to compensate for that, or you'll need to look at that when you do the statistical analysis. What we then do is we take the 2 groups through a procedure, which in this case, the intervention group will get home-based exercise. The placebo will get, we'll just say, talking therapy. They just go and sit in a group and talk. We don't think it's going to improve the balance, but obviously we wanted something they to do. We then measure it again at the end of the study. The best case scenario, if we know they're comfortable at the start of the study, we can just do a direct comparison to the end of the study. If they're not, what we need to do is a difference within difference. So what we do is we compare that distance from there to that distance in there to make sure that the distance travel is the same, or in this case different. So we're hoping that our intervention group has got better in regards to balance compared to the control group over the period of time. Does that make sense? I think it does. Cool. What I'm going to do is at the end of the session, I will give you time to ask me questions, and I'm also always happy for you to send me emails or questions, follow-up questions at the end of these sessions. So I'm really happy at any point if you suddenly watch the video back or you've got any urgent questions along the way, please just make a note of them and send me an email. I'm happy to answer things if I go too fast at any point. The other thing we're going to talk about is non-randomization. It's just the same. The only thing what we do is we don't randomize. So you see here, I've took away the randomization sequence. We allocate the patients to a certain group and then allocate the other group. The issue is that there is possible introduction of bias. So if I had a motivation to make home-based exercise look a lot better than placebo, I could allocate patients who are maybe more severe to the intervention group compared to the control, making a biased group at the start, which may make my intervention look more effective than it is. So it's just something you need to be aware of, that the randomization sequence hopefully produces that equal balance and obviously stops people manipulating the data to make things look more effective than it should be. The other type of study which you'll see would be a repeated measures, or the actual real name is a single arm study. Repeated measures slightly different, but a single arm study, which is where we get the population, which is Parkinson's disease patients. We provide them an intervention, and then we observe them over a period of time. So we similar to like an RCT, except we don't have that control. So what we're doing is we're getting our population, we're giving them exercise, and we monitor them right at the start. So kind of similar to actually a study design and what we're doing with this training course. So at the start of the training course, we've took a baseline measurement of your perceptions and knowledge of the particular area. And at the end of the training course, we'll reassess to see if you've improved. So obviously the advantage of that is that it's relatively simple and it can work with most intervention types. The kind of disadvantage is that you don't know if it's a true effect. So in the sense, you don't know if it's just the patient getting better over time because obviously they've gone home and got better, or is it actually the intervention? So the causational relationship is weaker, but that's the idea. There is things you can do to kind of establish greater effect. So you can look at mediating factors or more directional causation, but typically it's a very simple design, but it allows you to scale it, and it also gives you increased power. If you've got a small sample size, you're not splitting your two groups up, you're putting it in a single set, which can help with certain statistical tests. So what we're going to do is give you some, I'll just bring them up. So I'll give you some examples of clinical questions, and I want you to just try to pull out the P-core variables from these questions. So these are studies which have been done. I think the titles of studies, if I remember rightly. What you need to do is have a read through these and just see if you can still think in the right context. What actual variables are these studies identifying? So the way you'll do this is if you want to write the title down, or you could even just write the P and then the word, and then the I, which is the word. I think, do I have it on this? Do I have the, I'll just check. I don't want to jump forward, and no, I don't have it on this. I was going to bring up the table, but if I'll obviously, it's up there, the acronym actually, if you can't remember. So it's participants. So we want to know which participants are done within these studies. What intervention did they carry out? Did they have a comparator? So there is one on here. I think there's a comparator, but it's a bit of a test for you to identify it, and then what outcome were they measuring. So if you have a look through these particular questions or titles, you can tell the third one I was looking for something a bit more creative about juggling, but the idea is you can pull out the P-core variables. So if you want to have a go at that and then type it into the question bar. So when you've, I mean, you don't need to do it for each of these. Probably there's quite a lot of work there. If you want to do it for a couple, then we'll see how we get on. You can probably write them down, as we said. If you just put P, you obviously got question one, but P, and then the I, and the C, and the O, and then pull out the variables for each of the question. The next slide, anyway, we'll have it all broken down for you. So what I've done is kind of just next to each word. So what I've done in my case scenario, I've wrote the question down, and then next to the letter which represents that concept, I've just put it in a bracket so you'll be able to see the particular one. But you see how this type of approach allows you to kind of specify into a specific scenario. So it allows you to start thinking clinically from a research perspective. What would I need to do to carry out the research? And in your case, what would I need to do to find the research, and what type of research would I be looking for? So you can start thinking about it in these concepts of these particular variables. Brilliant. So we've got the first one up. Yep. So what I'm going to do is obviously just give you the kind of the answer. I think we've got maybe the first one done. I'm just aware of time, and I don't want to focus just on effectiveness. I do want to briefly address the other types, and I realise it's 25 minutes left, so I don't want to just focus on this. I've got 4 more to cover. So we'll do.
James, I think you're on mute.
Indeed, I am. There we go. So yeah, sorry about that. It's because I was reading some people's answers, so sorry about that. Yeah, so what I'm going to do is obviously go on to the next slide and just give you the kind of answers, just because I'm aware of time. So the first intervention type is looking at virtual reality, and as somebody's correctly said, virtual reality compared to conventional physiotherapy for upper limb function in children with plexus injuries. So you see how we've broken down the individual variables, which would lead to obviously identifying particular study types. In this case, we're looking at the exercise, and we're looking at, so it's interference of exercise compared to, I'll talk about the comparison in a minute actually. So it's exercise and how it's effective in reducing depression in people with depression. So looking at depressive symptoms. So this is the one which was a bit more complicated because the comparative, the comparison is in here. So this is a particular type of study where they do a dose response. So what they may have is they'll have multiple groups, and each individual group would have a different level of exercise. So one may be walking, the next group will be jogging, and the next group will be running. And what they're trying to see if the intensity of the exercise changes the effect. So we do assume that high intensity exercise often has a better endorphin effect and also reducing depression. But that's the idea, is that they're trying to look at if a dose response, and it could be intensity or it could be duration. So they could be actually doing 10 minutes compared to 20 minutes compared to 30 minutes. So the next study type is ball juggling, looking at reducing blood pressure for medical students. So we've got the PICO there. So the intervention is juggling. The outcome is blood pressure and sleep quality, and the population we're looking at is medical students to the end of exams. How did everyone do okay? I'm going to say I don't have any people's cameras at the moment. I've only got pictures of screenshots, so I don't have any nodding. But I assume everyone did all right. And I say, if anyone has any problems or I've lost anyone at any point, please don't hesitate to drop me an email. And as I said, all this is recorded. So we're going to move on to prevalence. From a prevalence studies perspective, I'm going to firstly just give you a brief introduction for what is prevalence. This is why I think I talked about the majority of it. I would recommend you to use effectiveness initially for this. So the one we've just gone over today about the PICOs is probably the one which I would find that you'd have an easier experience. But if you do feel confidence that you understand understand effectiveness, you understand how those type of studies work, and you want something a bit more challenging, I'm going to talk through a couple of more study types now which you may want to have a go at it, which are a bit more complicated. But it's just like I say, depending on where you are in your development, I want you to be able to choose where you want to challenge yourself, or you want to just get the basics down initially. So I'm just going to give you a brief introduction of what is prevalence. So prevalence is if you want to know in a particular given population how many of that population has a particular condition. So we may say how many people in the UK currently have COVID-19, and it usually represents as a percentage. So what I'm going to do is later on I'll give you some other clinical scenarios which I've been involved with, which is about measuring mental health issues in the healthcare workers. So the other thing we can measure in epidemiology studies is incidence. So incidence is a slightly different measurement. What it tells you is how many people within a given period of time has that particular event. So as we talked about at the start, the government produces a daily report of current people with COVID-19, so how many people in that day are diagnosed with COVID-19, and that's at incidence rates. So it's telling you how many. This might be interesting or important for somebody who may be running a clinician or a practice, because they need to order tests. So what they want to know is how many people, we could say how many incidents of people getting the test, so we can know how many tests we need to order. So if this is a new service we're provided, and we've never provided it before, and we want to have some estimates of how many tests we would need to order, we try to find the incidence rates for that particular test over a period of time. Most incident rates are presented over a year, so it'd be patient years, but some patients, hopefully, like I say, some studies do actually give you the data in more interpretable data sets like day, weeks, etc. So often we get told to present the data in the most relevant unit to practice. In context of what does all that data means, so you've got your incidence of how many, so how many people are getting COVID. You've got your prevalence, which are how many people currently have COVID. And then you have obviously the output, which is either mortality or recovery. So this kind of gives you that balance. So you'll know, when you know the incidence, you know how many people are getting it. And then when you know your prevalence of how many people currently have it, so that would provide the data about if you're providing a service, how many people would maybe need rehabilitation. And then from an output perspective, how many people are curative or getting better, and then the mortality element. The other element which we are often exploring in prevalence studies is moderated factors. So when you do these type of studies, as much as you want to know how many people have the condition, you also want to know what type of people are more prone for that condition. So we want to know, for example, if there's certain ethnicities or certain age groups which may present with that particular problem. So for example, with the pandemic, we may be interested that do the older population present with COVID-19 more than the younger population? So we look at certain factors which may be modifiable, which things which increase that particular prevalence rates. And there's ways we do that. We either put all those people in a cluster. So we say, let's go and get our population and split them. We'll have all the older people on one side of the population, and we'll have the younger people on the other side of the population. We'll reassess the prevalence, and we'll see if that prevalence changes. And if we do, we may have a moderated factor. So because we've categorized the older population to one group and the younger into the other, and we see a higher prevalence in the older population, we can say that there's something going on in that population which is causing them to be obviously increased. It's only a moderator, so that means that there's association. It's not a mediator, so it's not causing the effect. We just think there's something going on, and we're not sure why that particular population may be more prevalent than the other. The acronym which we use for this is called COCO POP, not Cocoa Pops, and I know I've put Cocoa Pops, but that's just to remind me of the acronym. In regards to the kind of breakdown of what this represents, you've got your condition. So I'm going to give a review which we've just recently finished, which is about the prevalence of mental health conditions during the pandemic for healthcare workers. So the condition we were looking at is mental health. The context we were looking at is the pandemic. So we wanted to look at previous pandemics, and we did have some studies from COVID-19. The population we were interested in was mental health, healthcare workers. So we wanted to know if staff are presenting with mental health illness, such as PTSD, depression, anxiety disorders. And we looked at study types we didn't really specify, but we were looking at either the prevalence or incidence. So we tried to identify, this was actually a study commissioned based on a clinician request. So the clinician was looking to set up a preventative service for mental health conditions which her staff members may present with. And what they wanted to do is see how many staff members would be presenting with these particular issues. So how much service provision would they need to provide this extra supportive strategy, and also how much sickness and illness will they possibly predict within the pandemic period and after the pandemic. But that's how the question's broken down into these variables. But like I say, the question is often coming from like a service level delivery perspective. So commissioners and GPs and commissioning groups often ask these type of questions because they want to know how common a particular issue is, so they can then start providing a service to obviously prevent or combat or support that particular issue. So what to do is try to think of your own. So I'm just going to give you a couple of minutes. I'll probably give you maybe 2 minutes just to quickly in your head. You don't need to write these down, in the sense of just breakdown of what would be a condition you would be interested in. What would be the context? So the context in this case I've put pandemic, but it can be anything. So usually they're like acute or community, so they vary in regards to the clinical setting. And then the population, so we could look at a subgroup of an aging population. So we say older people, young people, we could say males, females. So these ways you can subcategorize your population for prevalence studies. And then you have to decide what type of study. So if you're interested in how many, so how many people have the condition, you would go for prevalence. If you're interested in how many people are getting the problem, so in the sense we may be looking for more of an event-related scenario, so it could be violence. So I've just done one recently about challenging behaviours in stroke, and we looked at the incident rates of how many people have challenging behaviours within the 7-day period of admission. So it could be how many people are actually having the scenario of an event, which may be, obviously in this case, challenging behaviour. But that's the idea, is that you try to think of what type of, are you looking at how many, or are you looking at how often? And that will define if you want to use an incidence or prevalence. So if you want to have a quick go, if anyone's brave enough to type the question into the chat bar, and I said I didn't write them down, but if you do have the time, you can type all your answers in. What time is it? 15 minutes left, not too bad. Okay, I think what I'm going to do is I'll just give you some, do I have scenarios next? What do I have next? Oh, so what I'm going to do is to give you some examples of the studies. So now you've got kind of the idea of what type of the kind of PICO variables there are, and this Coco Papa variables there are. What we're going to do is show you some examples of the atypical study types which you may find. So this will just give you context of what you'd be looking at if you were looking at prevalence. And I'll do it quite quickly because they're relatively simple. So cross-sectional means that you get a population, and this is often a prevalence type of study. And what you're going to do is you're going to see how many of those populations have the problem. So we've surveyed Preston, and I wanted to know how many of those currently have COVID-19. So how many are currently actively diagnosed with COVID-19, and a count. And I give you a percentage of, at the moment, there's 10% or 0.1% of the population who currently have COVID-19 in Preston. So it's usually a cross-sectional where we're taking a section of the population and we're asking how many of those people have a problem. The other way we're doing it, we can do a cross-section cohort study. So using that term, so cohort study, which is taking a population over a period of time and then observing them to see how many present with that phenomena. So this is more likely to be an incidence rates. So what we do is we take, in this case, say 3 days, and we watch those people over 3 days and we count how many of those people present with a particular issue. So in a sense, we could do the scenario of violence. So we, in our acute stroke ward, and over the 3-day period, we see how many of those patients present with anger or aggression, and we count those to give us an estimate of how common this particular issue is. So how often are we seeing this in practice? The other scenario is a case control. So these are mainly retrospective. So that means that we've had a problem, and what we want to do is explore what the prevalence, or more likely the moderating factors, are causing that particular problem. So what we do is we identify a case study type. So we're looking at patients who've got COVID. So in this case, it may be males. So what we're going to do is we're going to get a subcategory of a population of males, and then what we're going to do is compare them to other males, which are a control, to see why the patients who don't have COVID, so we'd get the case control in this case to not have COVID, why do our males in the red group have COVID, and why do the blue males don't have COVID? And we see if there's any factors. So what we might find is that the ones who have COVID are more active, or they're more they work in certain industries, so we could find that might be an association. But that's the idea, is that we're looking at a population in a retrospective way to identify if there are particular values which cause causation or association. So I've got another kind of scenario to test your knowledge on this. I'll just see what the time is. We've got 2 minutes. We can do 2 minutes on this. And what we're going to do is have a look for this quick clinical scenario, and I want to see if you can just break down the clinical question just to these values. So this is the same Coco Papa. So we've got context, condition, context, population, and prevalence or incidence. So if you have a look at the scenario above and see if we can break it down. So first of all, we want to know, probably the easier thing to find out first of all is what is the population. So who is the population? What would be interested in? Then we'd ask, what is the condition? So what are we interested in as a condition? And then after, we look for context. So have we specified a specific context for our population? And then if you look at the thing, what they're actually looking at, you can identify if it's prevalence or incidence. So I think we shouldn't take too long to do that. Brilliant. So I'm going to just give you the breakdown for what that is. So in a clinical scenario, we would want to know the population of children age 14, so age 0 to 14. We're interested in allergies, so how common a particular allergy is, and we're looking in the Beijing area. So the original, because I've read the study and the references in the notes if you wanted to look at the original study, the study was actually looking at the prevalence and also commonality, the most common type. So as well as prevalences, all types of allergies, so how many people have allergies. They also want to know how many people had specific types of allergies, peanuts, shellfish, or whatever it would be. Well, this is kind of the clinical question broke down into a scenario. How common is food allergies in particular population in a particular area? So we're going to move on to SPIDER, which is an acronym to break down qualitative questions. So for the scenario I've got here is about, it was actually a race project we completed, which was on patients' experience or feelings of spirituality. So this was people who are end of life care, and they wanted to know what were the experiences of the family members of spirituality. So were their spirituality needs met, and how were they met? The way this breaks down is the spider works on sample. So who is the population? In this clinical scenario, it's the family members of the people who are currently in palliative care. The phenomena we're interested in is experience of spirituality. So how they experience that and how they feel about their needs were met. The design technique was interview. So they interviewed him. Typically, when you do a search strategy, I wouldn't recommend at all to define your design. So typically, when you write a spider breakdown, you want the sample, phenomena, and usually the element of evaluation, but that's not always key. So the feeling, because sometimes if you specify too early, you miss out studies. So mainly you want to look at the sample, and the phenomena would be kind of the starting point, and then maybe when you run a couple of searches you may find that there is actually more specific studies to your particular area, so you can be more specific in your search strategy. The last question you ask is if it's qualitative or mixed. Mixed would mean that it's got quantitative element in as well, so they've measured maybe a scale of something or kind of a level. So out of 10, how happy are you with your spiritual needs being met? And then qualitative studies would purely have the kind of interpretation of the text of the interview, etc. So you don't need to specify that really. You just search. I usually just include both types, but obviously depending on what you're looking at, you may find that if there's too much, so you may say I'm only actually interested in the feelings and the interpretation. I'm just trying to look for themes. I'm not looking for how common or the level of theme. I'm just looking at trying to identify themes, so you may want to specify qualitative only. So we're going to move on to kind of just the breakdown of study types. So I'll just give you a quick overview of the atypical study types. So in this case scenario, obviously they used interview, but there is other types of methods which may use. So you'll have interviews, you can have focus groups. So in interviews where they ask, if it could be structured or unstructured, but we'll say scenarios are structured, where they'll ask specific sets of questions for them to answer. You've got focus groups where you may bring all the family members in together, which has its advantages and disadvantages. Obviously, people may be quiet, people may talk over each other, or you may allow people to bounce off each other, which generates more ideas. So different methods have different advantages and disadvantages. And most of those are kind of captured in a lot of critical appraisal tools. The other part is observation. So what we can do is observe a phenomena and then text it. So we could ask people to interact, and then we copy the data verbatim and then see the kind of themes, what people experience and talk about within that scenario. The other part is survey, where we actually ask a large population of people particular questions, which is good for quick tools and also allows us to kind of survey a lot of people at the same time. So depending on the aims of the study, we may use the different tools, or we may use a combination of tools. So I'm going to go through just a quick scenario. So this is just a scenario of a study. Instead of me kind of asking you to do it, I've just done it underneath just because there's obviously time restrictions. I realise I've only got 7 minutes left. So this is just an example of a qualitative study looking at, in this case, people's perceptions of falls. So this is looking at what is the patient's perception of risk factors of falling, because they want to know what do people see as a risk factor in decision-making processes around falling. But this is these type of questions are where you're not sure about what's going on, and what you need to do is take a more exploratory approach to the data, because you know people are falling. You have your own preconceptions of why you think people are falling, but what you need to do is ask other people of why their perceptions may be different and may bring out things which you didn't even think of. So these type of exploratory approaches are really good at breaking pre-beliefs, and allows you to kind of use the data to find out what's going on. And then obviously if you are looking to take this further, you can then look at how common it is. So you could take it into a prevalence study. You could design interventions which may address these particular issues. So there is obviously development from these type of studies to more quantitative type of methods. So the last study type I'm going to talk about, which I have about 5 minutes left, is diagnostic accuracy testing. So this type of acronym is based around population, index test, test reference test, and diagnostic test. So this is where you would be asking the question, does this test I use every day actually test what it should be testing? So what they typically do with these type of tests is that you find a population, you find your test, what you're using, you then find the gold standard. So this is something they know is diagnostically accurate, and then they compare how often does that test correctly identify the same results as your gold standard, and then obviously you can have some idea of what the precision and recall is. In this case, I'm giving you a scenario of a PCR test, and I did specify a gold standard because at the time there wasn't any gold standard for the review which looked at this. But the idea is that you could start thinking about if you use the test in your own practice and you want to know actually does it test what it should be testing for, you can find studies which will tell you how accurate that particular test is. They are quite complicated because they use quite complicated stats. So just to give you a heads up, if this is the first critical appraisal topic you are doing and you're trying to do a diagnostic test accuracy study, you may find it quite hard going in the maths. But it's like I say, it is a type of study which is out there, and sometimes it is good to know from a usability perspective if the test is accurate and how often will it actually present data which isn't true. So in COVID, it's been a really important case if you're going to do mass testing, and we know that 10% of the time it's going to say they've got COVID when they don't, and we're testing 100 or 1 million people, we're going to have a large percentage of the population getting told to not work when they don't have COVID, etc. So there is important outcomes and ramifications for certain tests, and the test reliability in both false positives and false negatives have big connotations. So we're just going to move through quickly the type of tests. There are cross-sectional, as similar to prevalence. We get a population, we expose them to the first test, we then test them with the gold standard, and we see how many of those are actually accurate to the gold standard. So how many times did people say they have COVID to the gold standard compared to the new test which we've just invented? The other type of test is multiple tests. So it's a multiple comparison. So where we may have 4 different COVID tests and we compare them all to our gold standard. So this allows us to do large mass testing. But what you probably may have a problem with is that because you're testing multiple tests, you can have interaction effect. So certain tests, depending on what they're doing and how they work, they can actually affect the following tests based on obviously the accuracy, and that's why we often end with a gold standard, because we can see if it's had a connotation effect in the sense of the interaction effects of the different tests. The last type of test is a cross-sectional or case control study type. And this is where we feed the test the data we already know the results for. So we give a population to the test where we know they've definitely got COVID, and we feed another group where we don't know, or we definitely know they don't have COVID, and we see if the test does what it should be doing in regards to diagnosing the people with COVID and the ones we don't. And it creates you obviously a test reliability